The governor will be taking the podium in just a few minutes, but first let's go to Jacob Noderman, who's kicking off week 7 of these daily briefings. Jacob, it's going to be a big week for business owners.
Absolutely. The governor is still remaining optimistic, at least for the time being, on trying to reopen many sectors of the state's economy on May 1st, and that is this Friday. We've been talking a lot about this May 1st reopening, where bars and restaurants would be able to start operating as they would, being able to re-offer their on-site dining. However, bars, kind of a different situation. Bars wouldn't be open as part of the phase 1. It's part of a later branch. The governor has been basing a lot of these reopening policies off of the White House's guidance. And in that White House guidance, there are 8 different elements that go into it. But the problem is that, at least for the last week or so, as many times as these 8 points have been brought up, there's really only been one box that has regularly been checked throughout it, and that's the hospital capacity. Obviously, when we talk about the desire to reopen, when we talk about wanting to get Main Street back up and running, it all boils down to the ability to collect data, the ability to collect more testing. And over the next few weeks, the governor has been pushing, and the health department has been pushing their ability to really increase that capacity, upwards of 2,000 tests per day. And that's what was accomplished over the weekend thanks to the tests out in Fargo over the weekend. They've reached, I want to say it was over 1,900 tests in just one day. Certainly that helps, at least with the data collection, but it's not just the data that the government needs in order to reopen and feel confident in reopening. That data needs to show that there's a downward trend in the number of cases. And at least for the past 2 weeks, that has not been the case. I want to say it was mid to late April, we were at about a 3.3% positive rate. That's about, that means for every 100 tests done, a little over 3 people were found to be positive. Over the next 10 days or so, that number would double to more than 6%. 6 people for every 100 tests done would come back positive. Now, a lot of that number has a lot to do with the L&M plant outbreak that happened out in Grand Forks and the collection of data that goes out there. And now that there was that test over the weekend, the drive-through testing, that really bolstered the number of tests. It also bolstered the number of positive cases as well. So as we're starting to ramp up these positive cases, as we're starting to ramp up these testing, we're going to find where more pockets of these cases are. Are we going to find an outbreak? We don't know that, but the possibility of finding a possible hotspot could derail a lot of the governor's anticipated plans to reopen up on May 1st. And there's still an opportunity there, at least for now, where the governor says we want to keep this plan going, but one of those 8 boxes has only been checked. The other 7, well, the governor has 5 days to check them off before he wants to reopen.
Now, at this point, people need to have symptoms or need to have some reason to believe that they've been exposed to COVID-19 before they seek a test. Is there any talk about testing people just generally to see if it's in the population for people who are asymptomatic?
Well, a lot of that has been the motivation behind the drive-through testing. The drive-through testing, I want to say it was a few weeks ago out in Slope County. That's the purpose of those drive-through testing. They wanted to find a county that didn't have a lot of reported cases, and they wanted to see how this thing spreads in asymptomatic situations. And through that test, while they did find only 3 individuals who were asymptomatic who also tested positive, that was the point where we had to kind of start shifting how we approach the testing strategy in saying that, yes, indeed, this thing is spreading, because in that same case, 3 people were found to be asymptomatic and positive, but 3 people who were symptomatic were also positive as well. So while there's been this push for drive-through testing, especially out in Fargo, where most of the COVID-19 cases have been found, it's certainly shifting that strategy. For the time being, at least, the governor is still pushing, if you think you have it, call your medical provider. Get tested. When in doubt, get tested. Right now, at least, there hasn't been a really significant push on trying to get more asymptomatic people tested. While we have been asking the governor what kind of role these asymptomatic cases are playing in the strategy, it's more of a question of surveillance testing, which is something that North Dakota is, at least, it's not at a point to where it can consistently do those surveillance testing. Certainly we want to get to that point. Certainly they've been trying to get to that point, but we just don't have those resources, at least not yet, to carry that kind of testing. And as we consider reopening on May 1st, as we're getting close to the time of these executive orders expiring, surveillance testing is going to become a kind of a more reliant tool, because in order to see where this thing is going, you have to be able to see who's asymptomatic but still carrying it. And while we're still trying to get the resources for asymptomatic testing, there's now kind of a shift towards the antibody testing, meaning that there's a test that the governor is trying to bring to North Dakota. I want to say there's 150,000 tests that the governor has at least requested. There are 10,000 on the way for these antibody tests, which essentially doesn't show if you have the coronavirus right now, but it shows whether or not you've had it in the past. That's certainly going to be a shift in the strategy and seeing where this thing is going, or at least seeing where this thing has gone.
There are so many unanswered questions right now. For instance, do the antibody tests show that you're going to not be able to get the disease again? There's also, Montana has reopened in a phased approach. I think people are wondering, if we do reopen on May 1st, is there a possibility that we would shut down again if the numbers ramp up?
Well, that's certainly the governor has said that he's certainly open to doing. There are some individuals who think that we would open slightly on May 1st, and then once that second surge comes in, we would have to re-implement a lot of those executive orders that kind of slow down the spread once more. And as you mentioned, Montana opening up. Minnesota has been relaxing some of their regulations as well. And obviously when we talk about Minnesota, we got Grand Forks on the border, we've got Fargo on the border. So the economies opening up on the other side of the border is certainly going to play a role in how this disease spreads in North Dakota as well. For those unanswered questions as to whether or not you can catch it again, that is certainly something divided amongst the medical community. The CDC has said that there's not proof that you can recatch it. However, there is data that's been showing that says that individuals who tested positive, who have then recovered, get tested again and then become positive once more. Retesting isn't necessarily a huge or significant part, at least not for North Dakota's strategy, not yet. Once again, a lot of that is boiling down to surveillance testing, which we're not at a point to where we have those resources to be in. But when we talk about other states and the roles that they play and whether or not North Dakota is trying to open up, this is something that we discussed about a month ago when other states started to shut down and North Dakota remained open, at least for the most part, as we continue to be right now. So it's the same conversation we've been having before, but now it's kind of those roles have been reversed. And if how things worked out a month before is any indication of what is to come, I would expect that a lot of those decision-making in Montana or in Minnesota or in South Dakota isn't going to play at least a significant role in the economic policy that North Dakota has been seeing, but it is going to play a role in the medical resource game that we've been seeing. When we talk about Minnesota wanting to open up, there have been individuals who were tested in Minnesota and then were treated in North Dakota, simply because that's where the medical centers were located at the time, right across the border. It just happened to be on the North Dakota side. So when we talk about North Dakota wanting to open up on Friday and then possibly opening up, going through phase one, kind of just loosening up that valve just a little bit, there is that possibility that we see a possible second spike in North Dakota, even though in North Dakota you could argue that we haven't seen that first spike yet. Yes, that we did see that spike of, I want to say it was nearly 100 cases in one day. That was connected to a very specific, and at least for now, isolated outbreak in Grand Forks. So you could argue that North Dakota hasn't seen a spike because there hasn't been that pattern of a spike yet. It's been more of an isolated circumstance that we've been seeing. So while North Dakota hasn't seen the pattern of the first spike yet, once you loosen up that valve just a little bit and you have other individuals from other states coming in here and doing their jobs or seeing their families and whatnot, maybe that's when we start seeing that second surge. And the governor has said, even before we get to May 1st, plans can change. This is going to be an evolving solution for the next 12 to 18 months. So we should expect rather difficult and economic decisions to be made, not just in the coming week, but in the coming months to years.
That's right, and there is also a lot of talk around the United States about the difference between the political view and the medical view. And even at the White House, you're seeing that difference where doctors are being very, very cautious, as opposed to, people that want to, the president included, really are anxious to get the country reopened because of the economic situation. It's where does the governor fall in that line?
I'm sorry, could you just kind of rephrase that question as to how the governor plays a role in deciding which doctors to follow?
That's not it. I was just saying that doctors are very careful and cautious as opposed to a lot of politicians who are anxious to get things reopened. I'm talking about some of the governors in some of the states, and I'm just wondering where the governor stands here in North Dakota on that issue.
Well, the governor has been following, at least he's been preaching the guidance of the CDC since day one. Even before, I want to say it was probably March 13th, somewhere around there, the Friday before the schools closed down. The governor said on the day that we first declared the state of emergency that we were going to follow the CDC guidelines. There were protocols in place for schools specifically. It was one case found in the school, you shut down for 48 hours. 2 cases found in the school, you shut down for 14 days. If there's community spread, you shut down for 14 days. There are other criteria, and we're now being told that the governor is entering the room.
Good afternoon, North Dakota, and welcome to today's briefing. North Dakota Department of Health confirmed today 75 additional cases of the novel coronavirus disease, or COVID-19.